Hello, everyone. My name is Radwa, and this is my presentation on mental health and substance abuse. So I really enjoyed reading this chapter very much. The part that surprised me was when I came across the psychoactive substance segment, and I didn't realize that people were mixing things are over the counter to get high from or to mix in with other chemicals, such as the sleep-inducing or wake-up pills, nail polish removers, aerosols, alcohol-based hair lotion, even glue, cough syrups, and spray paints. Um, I was also surprised the fact that those items are responsible for for an extremely high number of suicides. Um, and because of that, they are kept behind the counters and no longer are available over the counter. An individual must be registered and they have to show their ID before buying any of these. The segment that didn't really surprise me was the illegal drugs that are being manufactured from inexperienced chemicals in the labs. The street drugs are always often diluted and they're contaminated with items that I've mentioned, such as cough syrups and other unknown materials and drugs that really the drug seekers are usually unaware of, and they don't know if what they're taking is pure or diluted. And because of that reason, um, this environment is really uncontrolled, and they might have an unintentional overdose or have side effects that would really lead them into a medical emergency. And this really could be very difficult to control as it is unpredictable for EMT and paramedics. Um, if they don't know what one has consumed, they really sometimes won't be able to reverse it. The situation might actually place a level of danger to all 911 responders at this point. For the things that I have learned while reading the textbook about substance abuse and mental health is that for substance abuse, I didn't know that the synthetic anabolic steroid is actually considered a substance abuse, and that people who are athletes usually take it, and bodybuilders also, and they abuse the steroids to gain more muscles or look like they have the muscles and the shape that they need. People also with eating disorders take it to build body mass and enhance their performance. Marinol, which is an active ingredient of marijuana, is actually legal and it's available for controlled treatment for nausea and vomiting and wasting that is associated with cancer, chemotherapy, or immunodeficiency syndrome. Um, Often the cycle of substance abuse starts with the needing to take depressant, some form of depressant to relax and be able to go to sleep. And then eventually those people will need a stimulant to wake up. And the need for these drugs may increase. And this is kind of a little scary because a lot of people do need coffee to be stimulated enough to wake up in the morning. And if they have too much caffeine, they might need something to let them to sleep. And it's really a vicious cycle. For the mental health, um, the mental illnesses are classified using the DSM category, which stands for the Diagnostic and Statistical Manual of Mental Disorders. I researched a lot about the DSM as I was unaware of what it was. Many mental disorders have a genetic components that we knew, but also, more importantly, stress may play a role in the development of the illness. And lastly, the first generation antipsychotic drugs, atypical and typical. The typical part the typical medications can cause Parkinson's. Signs such as excessive extrapyramidal activity, and then with the prolonged use and high dosage, the individual might have tardive dyskinesia, which is irreversible. And for second generation anti-psych meds, the atypical medications can cause diabetes and weight gain. So for patients who have high blood sugars or are gaining weight and it can't be explained, it's really important to check their medrec list and see if they are on any of these medications. That's very important to be aware of. Um, for number four, people who are on narcotics for a prolonged period of time, they risk becoming dependent because these drugs are addictive and they create a state of euphoria while completely getting rid of their pain, which is great. But about 21 to 29% of the patients who are prescribed opioids for chronic pain end up misusing them, and 29% is a really high percentage. And about 80% of the people who use heroin first started what misusing prescription opioids. So the provider is really it's really important for them to recognize that substance abuse is hard because the pattern of taking it might vary from one person to another. Some people can even function well while being on it. And like I stated before, some atypical anti-psych meds can cause diabetes, and one has to really be aware of that side effect. The provider also has to recognize the individuals who are at risk factor for developing such for substance abuse, or recognize the individuals who might be at risk for it. So it's really important to look at the whole picture and avoid having any tunnel visions. Also, as a provider, you have to really create a safe, non-judgmental environment for your patients so they can feel safe and be open to talk to you about anything. I think that part of medicine is really important to just have a one-to-one conversations with them so they can really rely on you to help them and come to you with any issues. We also have to remember that we are treating the patient and not their issue or their diagnosis. For the certification track, um, I since I've been a paramedic for approximately 11 years now, and since we going to nursing school, graduating, becoming a trauma nurse, as well as a critical care nurse, my next plan is really going to CRNA school and getting my Psych NP program certification, and to eventually end up passing my national certification exam and doing a CRNA fellowship in chronic pain management specialized area. And my hope is for one day to really help patients with their chronic pain and help them work with them also to lessen their pain, but to hopefully help individuals in general just while controlling their pain, not misusing them and helping them in each and every step of the way to control their pain and to really use it as they need without and avoiding any mistreatment at all. This has been my presentation on substance abuse and mental health. Thank you so much for listening. I hope you enjoyed it. And thank you for everything this whole semester. Thank you.